Hello, everyone. My name is James Lambert. Dina Sobey and I created this presentation, which centers around the importance of Zika virus as a public health problem. Over the years, millions of people have become infected with the Zika virus disease, affecting over 70 countries and territories. The primary mode of transmission is through the bite of an infected Aedes species mosquito. The virus is an arbovirus, which is a group of viruses that are transmitted by mosquitoes, ticks, or other arthropods. They spread diseases such as flavivirus, chikungunya virus, West Nile encephalitis, dengue, and yellow fever. The origin of this virus was discovered in 1947 from a sample taken from a captive sentinel monkey within the Zika forest of Uganda, hence its name. The first human case of the Zika virus was in Nigeria in the 1950s, and only a handful of cases were reported over the next 50 years. Prior to 2015, Zika virus was found in Africa, Southeast Asia, and the Pacific Islands. The largest outbreak to that point occurred in French Polynesia during the 2013 and 2014 timeframe. In May of 2015, the Pan American Health Organization issued an alert for the first confirmed patient in Brazil. A significant increase in reported cases of microcephaly occurred simultaneous to spread of the virus in Brazil. Many countries in Central and South America, the Caribbean, West Africa, Pacific Islands, and the US reported local transmission of the virus. In 2016, the CDC and the state of Florida confirmed the first local Zika virus transmission by mosquitoes in the continental US. Additional cases were reported in the northern states, and it is believed that most of those cases were travel related, with an emphasis in metropolitan areas with major transportation hubs such as Philadelphia, New York City, Chicago, and Los Angeles. There were 5,168 confirmed Zika virus cases in the US and District of Columbia, with Texas only accounting for only 77.4% of the cases. It is estimated that 80% of the cases involve people ages 20 to 49, with 64% of those being females. Due to a warmer climate, the proximity to Mexico, and the potential for mosquito breeding habitats, South Texas and the Rio Grande Valley were of great concern for increased local transmission of the disease. During that time frame, the Texas Department of Health and Human Services recommended testing pregnant women who had two or more of the typical Zika virus symptoms in Cameron, Hidalgo, Starr, Webb, Willacy, and Zapata counties. Outbreaks of Zika virus infection peaked in 2016 and declined substantially from 2017 to 2018. And according to the data provided by the Centers for Disease Control, there have been very few reports of Zika virus transmission in the U.S. since 2018. But the disease remains a nationally notifiable condition, so healthcare providers must notify their local state and state health departments. While the symptoms associated with Zika virus are generally mild, consisting of fever, maculopapular rash, body aches, and conjunctivitis, there were reports of more severe reactions associated with neurological complications. In pregnant women, fetal neurological complications include brain damage and microcephaly, while adults have cases of virus-associated Guillain-Barré syndrome. The overall survival rate for non-congenital Zika virus in adults is over 99%. But the same cannot be said for infants, where the risk of death was 14 times higher among live-born children with congenital Zika virus than among those without the syndrome. And evidence has pointed out the condition persisted throughout the first 3 years of life. Initially, it was believed that the disease was primarily transmitted via the Aedes aegypti mosquito, but today, through epidemiological evidence and surveillance, we have a better understanding of the vector-borne disease and how it can be transmitted via the albopictus mosquito, and it has been associated with vertical transmission from a pregnant mother to her fetus, also through sexual contact and via blood transfusions. The Zika virus is diagnosed using PCR, which is polymerase chain reaction, and virus isolation from blood samples. Zika virus and dengue infections need to be differentiated from each other and from other circulating arboviral and non-arboviral pathogens using laboratory testing. Lab tests performed and interpretations of results must be guided by the interval between symptom onset or exposure and the collection of specimens. Interpretation of serological test results remains challenging because of cross-reactivity and prolonged detection of virus-specific antibodies. Their utility depends on the patient's current and prior flavivirus exposures. Zika virus testing for asymptomatic pregnant women remains challenging because unknown optimal timing of specimen collection and the risks of false positive and false negative results. For this reason, it is extremely important that any testing for the presence of Zika virus, dengue virus, and other pathogens in the differential diagnosis should be performed in appropriately equipped laboratories by staff trained in the relevant technical and safety procedures regarding Zika virus. In 2016, the New York Department of Health established a Zika pregnancy and infant registry, known as the ZIPR, as part of a national volunteer effort to monitor and collect follow-up information on all pregnant women with laboratory evidence of possible Zika virus infection and their infants. Surveillance conducted via the ZIPR identified a prevalence rate of 4.6% from 2015 to 2018. The data generated from the ZIPR has been successful due to the collaboration between state, tribal, local, and territorial health departments. These health departments have participated by identifying pregnant people and infants for Zika testing, coordinating Zika testing of laboratory samples, reporting of information about eligible pregnant people and infants with laboratory evidence of possible Zika infection, collecting medical information about eligible pregnant people and their infants, as well as working with the CDC to determine state-specific methods for collecting and sharing data. Their efforts have provided scientists with a better understanding of long-term health outcomes of infants infected with Zika virus during pregnancy. Today, the CDC has a new surveillance approach called the Surveillance for Emerging Threats to Mothers and Babies Network, also known as SETNet. It is an expanded network that builds upon the Zika Pregnancy and Infantry Registry, which serves as a preparedness network that can be further expanded if new threats emerge, such as COVID-19, hepatitis C, syphilis, and congenital cytomegalovirus. It uses actionable information to help save and improve the lives of mothers and babies.